Afternoon, Kirsty. Afternoon, Dan. Thanks for joining us this afternoon to talk about the exciting news, a new initiative that you've got going on across Worcester with your ACP development and plans going forward. So without any further ado, can I hand over for you to tell us what you've been doing and your plans going forward?
Yeah, no problem. So we're very proud and excited about our Advanced Clinical Practitioner programme here at Worcestershire Acute Hospital Trust. We've got the programme running across the whole trust, and basically we have introduced ACPs throughout multiple specialities throughout the trust. But here in acute med, we've really pushed forward with our programme. We're working across sites, working together. We're standardising our whole approach with the ACPs. We got fantastic executive buy-in into our ACP programme and moving it forward. And I'll hand over to Kirsty.
So thank you, Dan. So we've been lucky that we've got some good consultant sponsorship that's previously taught on ACP programmes. So now we'll have a mentor buddy system for all of our practitioners at different levels, right from our qualified, well-experienced ACPs such as Dan, all the way to people that are just about to embark on the Advancing Practice modules at the local universities. And that isn't just nurses like us. We're very excited and very pleased that we've got a body of pharmacists that work alongside us, treating and making care plans for patients in the same way that we do. We're also welcoming physios and paramedic practitioners to undertake some clinical supervision within our services to hopefully open up same-day emergency care ACP teams to anyone from any background, have a real MDT approach to the way we manage our patients. We've put a lot of work into this, hasn't been without challenges. There's lots of red tape to get through really, but
yeah, that's locally and nationally. As we know that the Advanced Clinical Practitioner programme nationally is starting to really hit the agenda, especially in the shortfall with the gaps of acute medics, and just bringing up a different pathway for different specialities to move up into. So we're currently embarking on a standardisation programme here at Worcestershire Acute Trust, so that we can look at everybody who works as an ACP. We can look at what their job roles are, what their job titles are, making sure they hit all the regional and national specs. And then from there, we managed to develop our internal training programme.
Yeah. We have that'll encompass, it's a 5-year training package that works alongside any Masters Advancing Practice study at university, but that involves weekly training with the ACPs across acute medicine involving simulation and basic core sciences, a journal club, a white paper kind of review team, and some guest speakers. So that follows every core competency that an ACCS or GP trainee medic might go under whilst they're in acute medicine. So real big exciting times for us here.
Absolutely. Very exciting.
Excellent. And I think that weekly focus on your training really gives you that sense of traction going forward, and it really gives that supportive aspect to the workforce that are undertaking. So for me, you mentioned some of the challenges. What have been the challenges and how have you overcome them? Because I'm sure you're not going to have been alone. Other folk across the country will have experienced similar.
Yeah, I think having spoken to the ACP faculty for the region as well, Kirsty and I both sit on that, that we know that ACPs everywhere are the unknown. It's kind of a new specialty that sits in between the grey spaces between medicine and your traditional nursing, physio, pharmacy type roles. So getting people to really buy into what we do and how we do it has been one of the biggest challenges. But as we mentioned at the start, we've got really good executive buy-in for our ACP programs, and they've commissioned our work to look at standardising the role and making sure that we got the support. And now we've got the support from the consultant bodies with the training programs and stuff.
And our chief nurse.
And very much.
Yeah, Paul is very supportive of this as well.
So it is all encompassing. Actually, the difficulties that we found to begin with are trying to recruit into roles that people were unsure what the role was, and getting the support mechanisms around the role to make sure that we're all governed and clinically safe to do it has been challenging.
Yep.
But you know, the local universities have been really good, and they've come down and spoken to us. We've been able to go up to them. We've gone and spoke at several of their conferences and things to talk about what we're doing here at Worcestershire. So I think as a regional ACP programme, it's getting much better. As a local Worcestershire Acute Hospital Trust, it's really kicking off now. Obviously, there's a lot of work to do. There's a lot of local and national policies that do block some of the things that we can do, such as the IRMA training, for instance. We know that a lot of work is going into imaging rights and things, and you know, but it's a good step forward for the trust, and it's always going to be a work in progress.
We're well supported from a prescribing formulary. Many of our practitioners are non-medical prescribers and will go on to be non-medical prescribers as part of their training portfolio. And we aren't restricted in the way that some other trusts restrict their non-medical prescribers, that we work safely within our areas of competence, which definitely benefits patients' experience, their own pain. They don't wait for antibiotics or treatments or something similar. Another challenge I would say we'd faced previously is documenting and recording our competence. We talked a lot about this portfolio, but are hoping to make that electronic, very similar to what the junior doctors and the medical training programs are very used to. That'll allow us to have specialist signed off assessments, observed practice and reflection, all in one electronic place that would be easy to showcase and refer back to at any point, which is real big strides into where we want to be in the future.
Yeah, it definitely, the ACP programme definitely encompasses what our trust beliefs are with our forward programme, and with our forward programme looking at our cultures, our behaviours, the ACP role definitely incorporates that.
Absolutely exciting times. So most importantly, how have your patients found your ACPs? How have they been?
Feedback.
Absolutely.
Yeah, or recommend the service feedback in both of our same-day emergency care areas is high, and we're really proud of that. We think that by being holistic practitioners that don't just look at the medical side of their presentation, but you know, the psychosocial and everything else that leads to an emergency need for support, our backgrounds allow us to encompass all of that and truly understand the patient. We use that to avoid admissions.
Absolutely.
Because we managed to get everything resolved at once, rather than leaving things hanging or leaving risks open so that somebody will fall again or will misunderstand their medication regimes. I think it's the future of medicine.
Absolutely. I mean, we get very positive feedback on we're actually able to help cut down waiting times, because we can start seeing the patients and, as Kirsty says, start prescribing their medications. They feel like they get their diagnostic and interventions much quicker, and it's much better to actually see somebody than just sit in a waiting area and wait for something to happen. So I think our friends and family feedback has always been very good. For the ACPs in general.
Excellent. Yeah, and you know, it is all about valuing our patients' time and really doing what's right for them in a timely manner. Excellent. And I have to say, your enthusiasm is absolutely contagious, because it really is, and you really have got a vision of where you want to be and where you want to go, and the values you uphold and you express are so patient-centric. It's really inspiring. So what's your next steps then?
I think for us it's continuing in the programme, work with our executive level management, and obviously we've got a new chief nurse, Paula, and to work alongside her and bring some of her expertise into our a new profession of ACPs. She's worked with them at many other trusts, so it would be good to get that. As the ACP programme does develop here in Worcestershire, it will only get bigger and better.
I think so, yeah. I think standardising practice, having a good training, which will bring us good empowerment and morale within the senior practitioner team. You know, the sky's the limit. What's next? Well, we'll carry on growing, carry on providing really good, high quality care for our patients, I hope.
Yeah, and keep smiling while we do it.
Yeah.
I'm sure you will achieve everything and more for your patients. I'm absolutely certain of that. Thanks so much for your time this afternoon, guys. Good luck, and I look forward to hearing from you in the future. Take care.